Fluid-filled spaces in the ovary are called ovarian cysts, and they are generally harmless, but sometimes they can cause trouble. This video describes about the possibilities of ovarian cysts, whether it is harmless or whether it requires intervention. I am Dr. Shobhana Mohandas. I work as a gynecologist and laparoscopic surgeon at Sun Medical Center, Thrissur, Kerala. We all know that why ovulation happens. The ova slowly grows. It grows into a follicle and it bursts. Sometimes this follicle, which is a fluid-filled space, grows even further into a cyst. These cysts are called functional cysts. They are probably 3 to 4 centimeters. They go off in 3 months or 4 months' time, and they are harmless. But when they are seen on an ultrasound or seen because there is an abdominal pain, people do get worried. Generally, there is no need for worry. It will go off on its own. There is no need to take medicine. If there is a hormonal problem, there is irregular periods, you can take medicines for that. But size of the cyst will go off without medicines. Now, sometimes this cyst will turn and cause severe pain, sometimes with vomiting, maybe even in school or college going students. This happens because the cyst turns and twists. This causes severe pain. This requires laparoscopic surgery to untwist the cyst and remove it. The ovary is also untwisted. Otherwise, if you don't remove this, it will stay there, become low, and the reproductive potential of the woman is lost. So it is better to do the surgery than keep it there. There is no need to worry. The woman, the girl, will not lose her fertility if it is done in time. Now, sometimes these cysts keep on growing till more than 3 months. These are not functional cysts, these are organic cysts, and they need removal because there is some disease in them, and if left alone, it can sometimes, very rarely, but go into cancer. Anyway, growing is not good for us. So, organic cysts will have to be removed laparoscopically. Mostly only the cyst need to be removed. The ovary is left alone. In older age groups, the ovary as such may be removed. There is a particular type of cyst called endometriotic cyst where the menstrual blood collects in the ovary and forms a cyst. These cysts, if they are large, may require cystectomy, but if it comes repeatedly, cystectomy is not advocated. But if it is very painful, sometimes even in younger age group, along with the ovary, the uterus is removed, and it can affect the fertility potential. There is another kind of cyst called the dermoid cyst, where there is hair and teeth and everything collecting in the cyst, and this cyst, if found, will have to be removed. That is, ovarian cystectomy has to be done, and the cyst is put into a plastic bag, and that is taken out so that the hair doesn't spill all over the abdomen. That's called in-bag removal of the cyst. Generally, they do not recur. That's what I see in my practice, although it has been described in literature. Now, cysts coming on both the sides and in very large size sometimes can be cancer, and the doctor has to decide whether she has to undergo cystectomy or if both ovaries have to be removed. Another thing I would like to say is that even if there are very large cysts, most often if they are not of cancerous nature, they can be removed laparoscopically, and there is no need to open the abdomen even in very large cysts. So in short, cysts can be harmless. Sometimes the cyst has to be taken out. Sometimes the ovary may have to be taken out, and sometimes in-bag morcellation may be needed, and sometimes medical treatment is advocated for endometriosis. Thank you so much.